Welcome to our video on Intertrigo. Let's begin. We'll discuss definition, risk factors, clinical features, diagnosis, and treatment of Intertrigo. Intertrigo is typically defined as erythematous inflammation that affects skin folds. Locations include inguinal, axillary, inframammary, and interdigital regions. It is mainly caused by or exacerbated by Candida species. Risk factors of Intertrigo include warm weather, friction, and obesity. Immunocompromised patients, for example, HIV-infected patients, are also at risk. Let's discuss clinical features. As we mentioned, Intertrigo involves skin folds like folds of the groin or inframammary region. It presents with moist erythematous patches. Intertrigo lesions are pruritic and tender, and patients often complain of burning sensation. Frequent scratching and poor management can give off a malodorous scent as well. Satellite lesions are characteristic for candidal involvement. These are smaller lesions distributed around the main erythematous lesion. We will see what they look like in a minute. Intertrigo can be complicated by secondary bacterial infections where purulence and crusting can be noted. Please notice the moist erythematous rash in the submammary region. We can see the characteristic satellite lesions looking like an extension from the principal rash. Remember that lesions of Intertrigo are pruritic. A 35-year-old obese woman presents to the office in July with a complaint of rash under her armpits that does not seem to go away. On physical exam, there is moist erythematous rash, which the patient states is often itchy. There are also several smaller lesions surrounding the main rash which exhibit itching and burning. What is the most likely diagnosis? In this question, we have an obese woman presenting in warmer weather with rash in her axilla. The rash is characterized as moist, erythematous, and itchy. It is key to recognize the several smaller lesions surrounding the main rash and are itchy and burning as satellite lesions, which are characteristic of candidal Intertrigo. So this clinical presentation with the presence of satellite lesions should help us make the diagnosis of Intertrigo, most likely caused by Candida species. Diagnosis of Intertrigo is mostly clinical. However, several tests are available to confirm the fungal infection. Most popular is the potassium hydroxide test. Skin scrapings typically show evidence of fungal growth such as pseudohyphae, which is consistent with Candida. Culture and gram stain can be performed if there is suspicion of bacterial infection. On this slide, pseudohyphae are seen under the microscope. These are consistent with Candida infection. The mainstay of Intertrigo treatment is reducing moisture and friction in involved areas. This includes aeration of the area and use of drying powder, for example. Topical azoles such as ketoconazole are typically prescribed as well. Topical corticosteroids can be considered if there is severe pruritus. Let's end this section with a board-style question. A 45-year-old woman comes to the physician due to an itchy rash under her breasts. She has a past medical history of type 2 diabetes mellitus and her BMI is 38. She had acne in her teenage years that resolved with treatment. Her vital signs are unremarkable. The physical exam reveals bilateral inframammary erythematous plaques with surrounding smaller lesions. Which of the following is the best treatment option for this patient? A. Topical metronidazole. B. Topical fluconazole. C. Topical clindamycin. Or D. Topical doxycycline. This obese woman with a BMI of 38 presents with itchy rash under her breasts. The physical exam reveals bilateral inframammary erythematous plaques with surrounding smaller lesions. This is a classic description of Intertrigo with satellite lesions caused by Candida species. Additionally, she has a past medical history of type 2 diabetes mellitus. Diabetes mellitus, in turn, predisposes patients to Candida infections due to high glucose consumption by fungi. The best treatment option for Intertrigo is topical antifungal medications such as fluconazole. Therefore, the correct answer is option B. Here is a slide reminding us of the treatment of Intertrigo. Pause the video and take a moment to consider this slide once more. Let's discuss why other options are incorrect. Option A is incorrect because metronidazole does not effectively treat fungal infection. Option C and D are incorrect because topical clindamycin and doxycycline are mainly used to treat acne rather than Intertrigo. Although this patient had acne in her teenage years, it resolved with treatment. And that concludes our lecture on Intertrigo.